something happens to injure your shoulder and then you get an MRI and you have a tear and then you get surgery, where if we just gave it a few months of rest and rehab, you may have recovered. And we try to be very conscious of that, knowing that information. Yeah. What is more clear cut is an acute traumatic tear. Like if you were to fall onto your arm and have a pop and all of a sudden can't move your arm, you're probably going to get surgery in that situation if you have a tear. Now that's a little bit more cut and dry. Yeah. If you're 65 and you fall and you just have some pain but have relatively good function, then we may try to slow roll that and see if you can get better without surgery. Do you have any examples of, you talked to the surgeons, talked to the doctors where you tried your best, everyone was working hard, but it just doesn't work out? Like tell me a story about that.
We have a patient right now that is dealing with, she's probably 3 months post rotator cuff tear, and she was kind of dead set on not having surgery, and we went with physical therapy and we're like, look, we're just not making progress. You need to go back to your surgeon. And now after her care, she was hesitant going into it, but I think having the care beforehand, so in that case, we almost kind of term that prehab care before surgery, really set her up for success after surgery. She's had a couple delays along the way, but I mean, I think as far as the grand scheme of things, where she was and what her goals are, surgery is what's getting her to maximize the quality of her life.